Mr. Johns, please, for 6 minutes.
Thank you, Mr. Chair. And thank you, Minister, for being here, and especially to your team and all the people on the front lines of this crisis. Minister, you read the article, I'm sure, in the Globe and Mail. It was a new research report that was released to the public, and it cited that British Columbians who were at risk of death related to illicit opioid use were 61% less likely to die from any cause in the following week if prescribed at least 1 day's supply of a pharmaceutical alternative. According to this research, it also stated that if they received 4 or more days of safer supply in 1 week, the rate of any cause of death was lowered by 91% in the next week, and death from overdose was reduced by 89%. Now, in British Columbia, there is 4,265 people on a safer supply pharmaceutical drug alternative. That's only 1.8% of the 225,000 daily users of illicit substances, that toxic drugs, that the other 98.2% are relying on the organized crime and the street toxic drug supply to meet their needs. Minister, looking at that, the scientific evidence demonstrates that the life-saving impacts of safer supply clearly is critical, and I'm concerned that your policies have been, created based on not on evidence, but because if you went on the evidence, you wouldn't take an incremental approach. You'd be scaling things up. And I'm concerned about the fear-mongering that's coming from Conservatives, and also the hesitancy to extend funding for the 21 safer supply programs that are providing effective care right now to thousands of people. Because, my understanding is if, prescribing data, that cutting the funding to these programs is dooming about 30% of federally funded safer supply program clients to their death within 6 months of ending those programs. So I guess I'm looking for you. Minister, what will you say to those families in 6 months if SUAP funding for safer supply programs is not renewed?
I want to thank my colleague for the question, and I always appreciate that you are such a strong advocate, not only for your community, but in tackling collaboratively the overdose crisis and the illicit toxic drug supply that is impacting so many of our families and communities. There are 24 safer supply programs in the SUAP at this moment in time. As I mentioned in my earlier comments, officials have been doing extensive reviews to ensure that diversion mitigation measures are in place. The new funding round of proposals has been accepted and is under review, and announcements will be coming soon for the programs that applied for, and amongst those, if they applied for renewed support, they will be available. They will be considered under that proposal program.
Minister, these people's lives are at risk. This is real.